Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Okay, so we're diving deep into obstructive sleep apnea today, OSA. And wow, you guys really sent a ton of stuff for us to go through. Like so much great information, but overwhelming, to be honest. So today we're going to sift through everything and try to get to the truly important stuff for all of us.
Yeah, I mean, you're right. It's easy to get lost in all the details, but the reality is this is something that impacts millions and millions of people. It might not even know it. It's obstructive sleep apnea, OSA. And basically it comes down to this. You're not breathing properly when you're asleep.
And that's kind of terrifying when you put it like that. So let's break it down. According to all this stuff, what exactly is obstructive sleep apnea? What's going on?
Well, first, the sources you sent all agree that it's the most common type of sleep apnea. And just so we're clear, there's also central sleep apnea and complex sleep apnea. But we're sticking with OSA for today, obstructive sleep apnea.
Okay, OSA. And I guess the word obstructive there, that's got to be important, right? What's actually getting blocked?
Right. The information explains that when you fall asleep, the muscles in the back of your throat, they naturally relax. But with OSA, this relaxation, it kind of goes too far. Like your soft palate, your tongue, the tissues, they basically collapse and end up blocking your upper airway.
Whoa, okay. So it's like your airway's too relaxed and just shuts off.
Exactly.
Yeah.
And when that happens, airflow to your lungs is reduced or even completely cut off. This can last for a few seconds or sometimes even over a minute, according to the sources.
A whole minute without breathing? Wow. Okay, so then what? How do you start breathing again?
Well, your brain steps in. It senses that dip in your oxygen levels and basically forces you to wake up for a split second, just long enough to tighten those throat muscles again and reopen your airway. Incredible, actually, a survival instinct.
So you wake up, you can breathe again, everything's good, right?
Not really. Here's the thing. You usually don't remember these awakenings. They're super quick, but they can happen a crazy number of times throughout the night, like dozens or even hundreds of times. And this constant cycle, blockage, waking up, breathing again, it messes with your sleep cycles big time. You might technically be in bed for 8 hours, but you're not getting good quality restorative sleep. It's the fragmentation of sleep that's the real issue.
Okay, so that's why you feel exhausted even after a full night's sleep. You're basically waking up all night long. So why does this airway blockage happen in the first place? I mean, it can't just be random.
Right. And the sources point to several factors that contribute to this, like your weight.
Makes sense.
If you're carrying extra weight, especially around your neck, it can put pressure on your airway. Plus, fat cells can release inflammatory chemicals that can mess with your sleep regulation. The research you sent is really clear on that.
Interesting. I hadn't really thought about the inflammation aspect. What else is there?
Well, anatomy plays a role too. Some people just naturally have a narrow throat or a larger tongue or a recessed jawline. And these variations, they can reduce the space in your airway, making it more likely to collapse when those muscles relax.
So sometimes it's just bad luck in the genetics department.
Right. And then there's age. As we get older, our muscles tend to lose tone, and that includes the muscles in our throat. So the older you are, the more likely you are to experience this airway collapse during sleep. It's a natural part of aging.
Okay, so we've got weight, anatomy, and age. Anything else?
Gender is a factor too. Men, they have a higher risk of OSA overall. But for women, the risk really jumps up after menopause.
Yeah.
Likely due to hormonal changes that affect muscle tone.
Got it. And what about our, lifestyle choices? Do those have any impact?
Absolutely. Certain substances can make things worse. Alcohol and sedatives, for example, they relax your throat muscles even more than usual. So if you have them close to bedtime, your airway is more likely to collapse. Same thing with nasal congestion. If you're stuffed up from a cold or allergies, you're more likely to breathe through your mouth. And that can increase the risk of airway collapse because your mouth doesn't provide the same support as your nasal passages.
Makes sense. Mouth breathing always feels less secure.
Right. It's all about that structural support.
Yeah.
And we should also mention family history. If you have close relatives with OSA, you're more likely to develop it too. Genetics definitely plays a role. And finally, even something as simple as your sleeping position can make a difference. Sleeping on your back can actually worsen the obstruction for many people because gravity pulls your tongue and soft palate back towards your airway.
So many factors to consider. Wow. Now, besides the obvious one, which is like loud snoring, what are some other signs that someone might have OSA? What should people be looking out for?
Right. Snoring is definitely a common sign. But the material you sent also lists a bunch of other symptoms, like waking up gasping or choking in the middle of the night, or waking up feeling short of breath. And of course, waking up frequently throughout the night for no apparent reason.
So more than just tossing and turning, you're talking about feeling like you can't breathe.
Exactly. And then there are other things like waking up with a really dry mouth or a sore throat. Even morning headaches can be a sign. And because your sleep is so fragmented, you're often super tired during the day. You might find yourself nodding off in meetings or even worse, while driving.
Yikes, that's scary. It really does affect every part of your life.
It does. And the sources also talk about problems with concentration and memory, irritability, even depression. And some people have to get up to pee a lot during the night.
So this isn't just about being tired, it can really affect your whole well-being. And these sources, they make it clear that untreated OSA, it's not just an annoyance, it can actually be really dangerous for your health. What are some of the risks?
You're absolutely right. It's much more than just an annoyance. It can have serious consequences. One of the biggest concerns is high blood pressure. When you stop breathing repeatedly during the night, your body goes into this fight or flight mode. Your stress hormones surge and your blood pressure spikes. Over time, this can lead to chronic high blood pressure.
Which we all know is bad news for, well, pretty much everything.
Exactly. And the information also links untreated OSA to a higher risk of heart attack and heart failure. All those drops in oxygen, they put a lot of stress on your heart. Over time, this can damage your heart and make it harder for it to pump blood effectively.
So it's not just a sleep disorder, it's a heart problem too.
Right. And it doesn't stop there. The sources also mention a higher risk of stroke. And get this, even an increased risk of developing type 2 diabetes. It seems like the disrupted sleep can really mess with your body's ability to regulate blood sugar.
Wow, that's a lot.
And it also impacts your brain. People with untreated OSA often have problems with thinking, memory, and concentration. Their immune systems can be weaker too, making them more susceptible to infections. And sadly, the research even suggests a link to an increased risk of premature death.
Okay, so this is serious stuff. So if someone is listening to this and thinking, wait a minute, this sounds familiar, what should they do? How is OSA actually diagnosed?
Well, the sources emphasize that getting a proper diagnosis is super important. You don't want to just guess. The gold standard is an overnight sleep study in a lab. It's called polysomnography. They basically monitor your breathing, your brain waves, your heart rate, your oxygen levels, all kinds of stuff while you sleep.
So it's pretty high tech.
It is. But the good news is there are also simpler home sleep apnea tests now. These let you track your breathing and oxygen levels at home. They're a good first step if you're concerned.
Okay, good to know. And thankfully, the info you sent also says that OSA is very treatable. What are some of the options?
Yeah, that's the good news. There are lots of ways to manage it. The most common treatment is CPAP. That stands for Continuous Positive Airway Pressure. It's basically a mask you wear at night that delivers a steady stream of air pressure to keep your airway open.
CPAP, that's the one everyone's heard of. Are there other options?
Definitely. Lifestyle changes are a big part of it too. Things like losing weight if you need to, avoiding alcohol and sedatives before bed, slipping on your side instead of your back, and quitting smoking if you smoke. All these things can help.
So it's about addressing those risk factors we talked about earlier.
Exactly. And there are also devices called oral appliances. These are custom-fit mouthpieces that you wear at night to help reposition your jaw or tongue to keep your airway open. And for severe cases, there are surgical options too. These can involve removing tissue, repositioning parts of the airway, or even implanting devices to stimulate the airway muscles.
So it's like a whole toolbox of solutions.
It is. And there's also something called positional therapy. This basically involves training yourself to avoid sleeping on your back. There are special pillows and even wearable devices that can help with this.
So to recap, OSA is basically when your throat muscles relax too much during sleep and block your airway. And this can lead to all sorts of problems, from daytime sleepiness to serious heart issues.
Right. The key is that cycle of obstruction, low oxygen, waking up. It really disrupts your sleep and puts stress on your body.
But the good news is that once it's diagnosed, most people see huge improvements with treatment. So if anyone listening is experiencing these symptoms, it's definitely worth getting checked out. It could really make a world of difference.
Absolutely. A simple sleep study could be life-changing. And with the right treatment, you can improve your sleep, your energy levels, and even reduce your risk of those serious health problems we talked about. It's really about prioritizing your sleep and your overall health.
And, some of the sources also touch on the connection between our mental state and sleep. It makes you wonder how much our mental well-being affects our sleep quality, even beyond the physical stuff like OSA. That's something to think about for sure. But the good news is...
The good news is that when OSA is diagnosed and treated, most people experience a really big improvement in how well they sleep, their energy levels during the day, and just their overall quality of life. It doesn't have to be something you just suffer with.
So anyone listening who's been dealing with loud snoring, feeling exhausted all the time, maybe even gasping for air at night, please don't ignore those signs.
That's right. If you think you or someone you know might have sleep apnea, talk to a doctor. Getting a sleep study could be one of the best things you ever do for your health. Taking care of your sleep, making sure you can breathe properly, it's a fundamental part of staying healthy, especially for your heart. So I'd ask all of our listeners, what's one small thing you could do tonight to help you breathe better while you sleep? Maybe try sleeping on your side, or finally make that appointment to talk to your doctor about your sleep. Because beyond those health risks we talked about, think about how much better your life could be if you were sleeping soundly and breathing easily. How much more energy would you have? Would you be in a better mood? Would you be able to focus better? It's really worth thinking about.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.